This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. Have you ever considered that your body might be sending you a critical warning signal that's completely invisible? It's not a pain or a lump, but a microscopic message that most people will never see and that many doctors might even overlook. This silent clue, hidden in the most routine of bodily functions, can be the very first sign of a developing health issue, including cancer. Yet because it's invisible, we don't act. We wait for something more obvious, and by then, we may have lost precious time. Today, we're going to explore this hidden signal, understand what it means, and learn about the modern, intelligent approach that urology has developed to investigate it. This isn't just about detecting disease. It's about shifting from a reactive mindset to a proactive one, taking control of your health and ensuring your quality of life for years to come. The condition we're discussing is called microhematuria, which is a clinical term for a simple discovery: the presence of a microscopic amount of blood in the urine. To be specific, the official definition is finding 3 or more red blood cells per high-power field when a urine sample is examined under a microscope. Now, it's crucial to understand what this isn't. It is not a diagnosis in itself. It is simply a finding. It is also not something you can confirm with a simple dipstick test at home or in a clinic. While a dipstick that's positive for blood is a reason to investigate further, it can be triggered by many things and isn't definitive. The gold standard is the microscope. Most importantly, microhematuria is not an automatic sign of cancer. In fact, studies show that urologic cancer is found in only a small percentage of patients with microhematuria, often around 1 to 3%. The causes are frequently benign, ranging from kidney stones to vigorous exercise to inflammation or an enlarged prostate. The challenge is to find the few who do have a serious condition without subjecting the many to unnecessary, invasive, and anxiety-inducing tests. So, how does the medical community work through this? In the past, the approach was often one size fits all. If you were over a certain age and had microhematuria, you likely got a full, intensive workup. But modern urology has become much smarter and more personalized. The 2020 guidelines from the American Urological Association provide a framework for a risk-based approach. Instead of treating every patient the same, we start with a detailed personal history and physical exam. We assess your specific risk factors for malignancy. Are you a smoker? What is your age and sex? Do you have a family history of urologic cancers? Based on this, we categorize patients into low, intermediate, or high-risk groups. This stratification is the key because it determines the next steps. A low-risk patient may simply have a conversation with their doctor and repeat the urine test in 6 months. An intermediate-risk patient might have a kidney ultrasound and a cystoscopy, a quick look inside the bladder with a thin, flexible scope. And a high-risk patient would receive that same evaluation, but with a more detailed upper tract imaging study like a CT scan or MRI. It's a tailored investigation, not a blanket policy. This risk-stratified approach is relatively new, formalized in the 2020 AUA guideline, but it's built on a solid foundation of evidence and a desire to balance benefits and harms. The previous guidelines, from 2012, were designed primarily to minimize the chance of missing a cancer diagnosis, which led to a very aggressive evaluation strategy for most adults. While well-intentioned, this resulted in significant costs, radiation exposure from CT scans, and high rates of false positive findings that led to even more testing and patient anxiety. The new framework is proven to be a more balanced path. It's based on a systematic review of dozens of studies and represents a consensus among experts on how to optimize the chances of a timely diagnosis while protecting low-risk patients from the harms and costs of over-evaluation. It's a shift from maximum intensity to maximum intelligence. Despite being the standard of care, this personalized approach isn't universally practiced. Why? One of the biggest barriers is the gap between primary care and urology. Studies have shown that less than half of patients with hematuria are even referred for a proper urologic evaluation. Furthermore, there are significant disparities in care. Women, for example, are often misdiagnosed with urinary tract infections, sometimes for months, which can lead to a dangerous delay in diagnosing bladder cancer and contributes to worse survival outcomes compared to men. There's often a tendency to attribute the finding to something benign without a thorough risk-based evaluation, which means some patients who need a workup fall through the cracks. Spreading awareness of these modern guidelines is critical to closing that gap and ensuring everyone gets the right level of care. For the patient, the experience of a microhematuria evaluation is now far less daunting than it used to be. For many, especially those in the low-risk category, the process may involve nothing more than a conversation about their low probability of having a serious condition and a plan to recheck the urine down the line. If you fall into an intermediate or high-risk category, the evaluation is straightforward. A cystoscopy, for instance, is a quick office procedure that takes just a few minutes. We use a flexible scope and numbing gel, and while patients may feel some pressure or the urge to urinate, it is generally very tolerable. It gives us a direct, real-time look at the lining of your bladder, which is where the vast majority of urinary cancers are found. An ultrasound is completely non-invasive, and a CT or MR urogram involves getting an IV for contrast dye and lying in a scanner. The goal of these tests is not to cause alarm, but to provide clarity and peace of mind. This is the essence of personalized urologic care. It's the opposite of a one-size-fits-all mentality. Your care plan is built around you. A 45-year-old female non-smoker with a small amount of microhematuria is in a vastly different risk category than a 65-year-old male with a 30-year smoking history. The guidelines provide a clear, easy-to-use table that helps clinicians place patients into the right risk category. This ensures that we are focusing our most powerful diagnostic tools on the patients who are most likely to benefit from them, while protecting others from unnecessary intervention. This is what truly patient-centered care looks like. A strategy tailored to your individual risk profile and concordant with your values. The effectiveness of this risk-based model lies in its balance. It is highly effective at identifying the small number of patients who harbor a malignancy, allowing for early diagnosis when conditions are most treatable. At the same time, it's effective at reassuring the vast majority, the 97% or more of patients who have a benign cause or no identifiable cause at all, without the cost, risk, and stress of a full-scale workup. This approach is designed to find what matters, whether it's a clinically significant condition, like a large kidney stone, an enlarged prostate causing issues, or an early-stage tumor, and to do so in the most efficient and patient-friendly way possible. Looking ahead, the future of this field is incredibly exciting. The next frontier in evaluating microhematuria will likely involve urinary biomarkers. Imagine a simple, non-invasive urine test that could analyze proteins or DNA fragments to give us an even more precise calculation of a patient's risk for urothelial cancer. A negative result in a low-risk patient might provide enough confidence to forego cystoscopy altogether, while a positive result could help prioritize patients for a more immediate evaluation. These markers are currently being studied in clinical trials. We're also seeing advances in imaging, such as enhanced cystoscopy, that uses special light to make abnormal tissue more visible, and new protocols for lower-dose CT scans that reduce radiation exposure without sacrificing diagnostic quality. I do this work because I believe in empowering people to take control of their health with clarity, not fear. For decades, the specter of a finding like microhematuria sent patients and doctors down a single aggressive path that often did more harm than good. Today we have a better way. It's a smarter, more thoughtful, and more personalized approach that respects the individual. It's about recognizing the quiet signals your body sends, having an intelligent conversation with your physician about what those signals mean for you, and confidently moving forward with a plan that is right for your specific situation. This is the future of men's wellness. Less uncertainty, less unnecessary intervention, and more precise, personalized care that allows you to live a long, healthy, and fulfilling life. Thank you for tuning in. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.